straight leg raising test is a very common test that is asked in almost all cases of PIVD at L4-5 or L5-S1 in DNB or MS exams. So for straight leg raising test, first, if the patient is complaining of pain, say in the right lower limb, then first you ask the patient to raise the left leg. अपना पैर उठाओ हवा में, ये वाला सीधा रखते हुए. So you ask the patient to move the leg that is not paining. Ask him to lift it straight as much as possible. जितना भी ऊपर उठा सकते हो उठाओ इसको. Good. Okay, नीचे रख दो. So now for SLR or straight leg raising test, first you do it actively. Basically when you ask the patient, अब ये वाला पैर उठाओ हवा में सीधा ऊपर, like this. So when the patient is lifting the leg up, supposing if he was able to lift this leg, the normal leg completely, in this leg when he is trying to raise, supposing at 40 degree he is saying that now he is getting pain, and the pain is traveling throughout the leg, basically going below the knee, that is important. So that tells us that now the nerve is getting stretched. So always do it with the normal leg first, then do it with the affected leg. So when the patient is himself doing it and telling you that okay, at this level I am getting pain, this is known as the active SLR test positive. When you do it, and for doing it you have to you have to keep your one palm over the knee and other palm under the heel, and then you slowly raise it, and then you try to raise it as high as possible. Supposing at 50 degrees patient is saying that now he is having pain and that pain is traveling down the leg, so we call it passive SLR test positive at 50 degrees. Now one flip side of it is, if patient is having predominant symptoms say on the right side, but when you try to lift the other leg and then at some point he is saying that because of lifting this leg up he is having pain radiating down the affected leg, that is the right leg, that means that either there is a huge disc, basically a huge disc which is pressing both the sides, but right side more than the left. Whenever there is a huge central disc, then this is, and patient is complaining of pain on the affected side, when you lift the non-affected side, that is known as well leg raising test positive. So this leg causes pain in this leg because of huge central disc at L4-5 or 5-S1. This is known as well raising test positive. So now coming to few modifications of straight leg raising test. First modification is, supposing if you want to know whether the patient is malingering or he is telling you the truth, you simply ask the patient to sit. If the patient is able to sit comfortably like this, that means there is no stretch pain going down the leg. This is a test to distinguish between malingering patient and true SLR positive patients. If the patient is having pain while sitting like this, then most of the time patient will say, I'll keep my hands like this, and he will lean back slightly so that the stretch in the leg reduces. So if the patient is sitting like this, that means he is telling you the truth and there is a pain radiating down the leg. Similarly, one more method of doing SLR is, you ask the patient to sit down like this. When the patient is sitting like this, the knee is flexed and there is no stretch on the nerve. Then while you just keep on talking to the patient, and then you lift up the leg and try to make it totally straight. Now if you can see, this is also a straight leg raising test. So if the patient is telling you the truth, he will immediately lean back and he will keep his hands by the sides like this, and he will try to relax his nerve. So if the patient is going into this position, this is known as the tripod sign. If the patient goes into this position, that means the sitting SLR test is also positive.